It's official. The Office of Civil Rights, or better known as OCR, will begin investigating data breaches of protected medical information that don't involve thousands and tens of thousands of patients. Now, in fact, OCR's new focus may very well include your practice. When we come back, I'll tell you what dentists need to know how to keep their patients' private information private. Thanks for tuning into the Patient Attraction Podcast. I'm Colin, receiver. Now, HIPAA violations, they can cost dentists a lot of time and money. And even worse, they can cost you the trust of your current patients and keep prospects from choosing your practice. Now, last May, I covered how dentists could prepare for a possible audit by reviewing the protocols posted on the Health and Human Services website. Now, if you haven't reviewed those protocols, go to hhs.gov/OCR. And it's more important than ever in light of OCR's announcement, August 18th. OCR is going to begin investigating data breaches affecting 500 people or fewer, and that could well include your practice. There are common sense steps that you have to take to prevent a data breach. And in the event of a breach, it's important to be able to demonstrate that you took proactive steps. Now, first, make sure that all of your software is completely updated and most recent security patches have been installed. Far too many practices get hacked because they fail to take this elementary precaution. OCR does not care. They are not understanding. Second, consider engaging an outside IT security firm to review and make recommendations. Now, you probably already have an IT guy. They may fit this bill. Ask them. They'll give you a good answer. Make sure you implement those suggestions and keep thorough documentation. Much like human resource issues, HIPAA is all about documentation. Now, it's almost impossible to completely secure your network if you're actually connected to the internet. But if you make it hard enough, they'll go elsewhere. The hackers will go elsewhere and they won't bother you. Now, third, have a written protocol for taking patient information out of the practice. A lot of data breaches occur when a laptop is stolen or left in a taxi while traveling. Make sure that anyone who will be taking that protected information out of the practice signs off on that policy. Fourth, take steps to secure your patient information inside the practice. That means avoiding accidentally exposing patient forms on a desk or locking away information securely when the practice is closed. And finally, dispose of unneeded confidential information properly. Data breaches from trash can divers are becoming more and more common. Follow these 5 steps, you'll be secure, you'll keep the government happy, and you'll be happy as well. Until our next podcast, keep moving forward.